This is Renee McLeod-Sordjan, and this PowerPoint will review ethics review committees in New York State, as defined under the Family Healthcare Decision Act, Public Health Law 29 CC. So many of you who are watching wonder, what is an ethics review committee? It is an interdisciplinary committee that addresses ethical decisions in care. Its purpose is to support decision-making when patients lack capacity and disputes arise, and there is no healthcare proxy form. It provides ethical guidance, generally advisory, and binding only in limited cases in which we will discuss. Ethics review committees have been established under the FHDCA, and hospitals must establish or participate in at least one ERC. Hospitals can adopt written policies on the functions, compositions, and procedures. Those functions must be to respond to healthcare matters raised by persons connected with the case. And that is very important. Either staff members, families, interested parties that are involved with a specific case. And they provide ethical advice, make recommendations, or assist in resolving and mediating the disputes. The recommendations are advisory under the law, and it requires ethics review committee approval. The membership must be at least 5 members committed to patient rights and public health. They must include at least 3 clinicians. One must be an RN and one either a licensed independent provider attached, so MD, NP, or physician assistant. At least one community member must have no hospital ties, and nursing homes, residence councils may appoint up to 2 outside advocates. They're triggered when either the surrogate requests it, or there's a withdrawal of life-sustaining treatment, or an ethical dispute arises. All involved parties may present their reviews with an advisor if desired. ERCs must provide notice of the procedures and the responses, and their recommendations must be documented in the patient's medical record. Treatments may not be withdrawn until the notice is given. ERC deliberations must be recorded, and that record is required for each case review. And it must include the Ethics Review Committee's reasonings and recommendations in the patient's record. Hospitals may adopt how those written policies for implementing and the review may occur, but documentation ensures transparency, compliance, and accountability. So when is an ethics review committee triggered? They're mandatory when there's a withdrawal of life-sustaining treatment in nursing homes. But disputes over capacity, the surrogate choice, or the life-sustaining treatment can trigger. And when there is a disagreement among the clinicians and family, particularly in minors among parents. Emancipated minors seeking life-sustaining treatment withdrawal also can trigger an ethics committee, but they're optional when they're ethical guidance in complex disputed cases. In the Family Healthcare Decision Act, the Ethics Review Committee is mentioned several times, particularly when attendings and consulting practitioners disagree on capacity determinations, when objections arise from the surrogates, families, or clinicians, a referral can be made to an ethics committee, or to review hospice care decisions for patients in hospice, in hospitals, or nursing homes. The ethics committee decision is rarely binding. There's usually advisory, but it can become binding when there's a surrogate decision to withhold or withdraw life-sustaining treatment in residential healthcare facilities, when the surrogate requests artificial withholding or withdrawing of nutrition, and the attending disagrees in hospitals, and when the decisions, as already stated, involve emancipated minors seeking withdrawal of life-sustaining treatment. In these cases, the ERC or court approval is required before the treatment can be withheld or withdrawn. So, these ERC proceedings are confidential. They're not subject to discovery in legal cases. ERC members acting reasonably in good faith are shielded from liability, and ERC members may access medical records, but they must maintain confidentiality according to HIPAA. The slides that have been presented here may be used for written permission, but they must be cited as the citation states below, and you can request that request from my email at rmcleod-sordjan@gmail.com. Thank you for spending these 7 minutes with me and listening to the ERC under the Family Healthcare Decision Act. Thank you.